Could this be the reason why your testosterone levels are nowhere near where you want them to be? In today's video, let's explore varicocele. Varicocele are enlarged veins in the scrotum, similar to varicose veins in the legs. Now, 15% of men are often discovered during evaluations for having a varicocele and can contribute to a significant amount to male infertility, as they can lead to reduced sperm production and also sperm quality. Now, don't forget that if you're a guy that has a varicocele, this could potentially be a reason why your testosterone levels are not increasing and you're seeing a steady decrease. So this is something that I encourage men to get assessed at least once a year, because a varicocele can develop at any point in time. And so they're one of the most common causes of male infertility, contributing to decreased sperm count and motility, which can hinder conception. So we can see in this image here, a varicocele is that enlargement of the veins in the scrotum. Typically, when doctors palpate or assess this, they can feel like a bag of worms. It's a sensation of like enlarged veins that can be noticeable from palpation and also through examination. So how are they diagnosed? Well, varicocele are usually diagnosed through a physical examination and imaging tests, and a healthcare provider will perform a physical exam to check for enlarged veins in the scrotum. Now, often they feel like a bag of worms and texture while the patient is standing, as varicocele can be more prominent in this position, so obviously needed to be standing up. It is important to note that in 78% to 93% of cases, the varicocele is located on the left side. So if you're a guy that's wondering whether or not you have one, there's a pretty good chance, or a very good chance, that your varicocele is actually on the left testicle. To confirm the diagnosis, a scrotal ultrasound may be conducted. This imaging technique allows for visualization of the veins in the scrotum and assessment of blood flow. Doppler ultrasound is particularly effective as it can measure blood flow dynamics and detect any reflux, which is characteristic of varicoceles. While many men with varicocele may remain asymptomatic, some report discomfort or a dull ache in the scrotum, particularly after standing for long periods or engaging in physical activities. This sensation can feel like a heaviness or pulling in the affected area and may worsen throughout the day or following intense exercise. Soreness is not universally experienced, however, significant discomfort can sometimes indicate complications such as testicular atrophy or hormonal issues related to the varicocele. If individuals encounter notable pain, changes in testicular size, or fertility concerns, it's advisable to consult a healthcare professional for further assessment and potential treatment options. So how are varicocele actually caused, and what are some of the contributing factors? The exact cause of varicocele is not completely understood, but there are a few theories. One theory suggests that differences in the way the right and left spermatic veins are structured could explain it. The right spermatic vein connects directly to the large vein, inferior vena cava, at a right angle, while the left one connects to the left kidney vein at a right angle. This difference could lead to increased pressure in the left spermatic vein, causing it to swell. Another theory is that varicocele may happen because the veins in the spermatic cord don't have proper valves, which can cause blood to flow backward and pool. A third theory, known as the nutcracker phenomenon, proposes that the left spermatic vein might be compressed between two arteries, the aorta and the upper mesenteric artery, say, which causes a blockage. If you're someone that's been trialing different supplements and you're still lacking that energy, spark, drive, and overall vitality, then you may want to check out my brand new supplement that I've just released called Catwa Pure. Catwa Pure harnesses the power of a particular Amazonian herb known as catwaba bark, which has been used for centuries to boost mood, enhance energy levels, and act as an aphrodisiac. So definitely check out Catwa Pure. You can learn more by visiting inbeforesups.com. So what are the negative impacts of varicocele? Now, varicocele have some key negative impacts, including infertility, testicular atrophy, and also pain. So here we can see an image that gives us a breakdown. We can see that a varicocele can lead to an increase in hydrostatic pressure and venous reflux, which can increase scrotal temperature, cause hypoxia, and reflux of toxic metabolites, which increase and drive up oxidative stress, reactive oxygen species, and decreased total antioxidant capacity, which can impair testicular function. So we can see here a breakdown of this. Number one is increased scrotal temperature. The primary way varicoceles affect testicular function is by raising the temperature of the testes. The pampiniform plexus, which are the network of veins leading from the testes back to the body, normally helps cool the blood that flows into the testes. When the veins become dilated, blood flow becomes stagnant, and the cooling mechanism is impaired, resulting in increased testicular temperature. The testes function optimally at a temperature slightly lower than the body's core temperature, and an increase in temperature can impair spermatogenesis, the production of sperm. This effect is particularly significant because sperm production is highly sensitive to temperature. Number two, as I said before, was hypoxia. Varicoceles can reduce the efficiency of blood flow to the testicles. This decreased blood flow may lead to hypoxia, low oxygen levels, in the testicular tissue, further affecting sperm production and testicular function. Number three was reflux of toxic metabolites. This also leads to the reflux of toxic metabolites, where this can lead to a backflow, reflux of blood within the veins, which is not only stagnant but may also carry with it various toxic metabolites and waste products that would otherwise be removed by normal circulation. And number four was oxidative stress. Varicoceles can lead to an increase in oxidative stress within the testes. The stagnation of blood flow and the consequent accumulation of reactive oxygen species can damage the DNA in sperm and affect overall sperm quality, leading to issues like decreased sperm motility, morphology, and concentration. So here are the negative impacts of varicocele. Number one is low testosterone. The Leydig cells in the testes are responsible for testosterone synthesis, and they are particularly sensitive to changes in their environment, including oxygen levels and temperature. The elevated temperature caused by varicoceles can directly affect Leydig cell function, reducing their ability to produce normal levels of testosterone. Additionally, hypoxia caused by impaired venous drainage can further compromise testosterone synthesis. Over time, this can lead to a testosterone deficiency, contributing to symptoms such as low libido, fatigue, and decreased muscle mass. Although varicoceles are more commonly associated with infertility, they can also have significant effects on overall testicular health, including hormonal balance. It is important to note that some studies have found that men with varicoceles may have normal testosterone levels, so it does really depend on the presence of symptoms and testosterone results via blood work. Despite this, the majority of studies do indicate that treatment of a varicocele via surgery does increase testosterone levels significantly. This meta-analysis on 9 studies, including 814 participants, found that surgical treatment for varicoceles resulted in a mean increase of 97.48 nanograms per deciliter for total testosterone. Importantly, this study found that men with low testosterone may benefit more from treatment of a varicocele rather than those with higher preoperative testosterone results. Analyzed testosterone and sperm parameters for 272 men. There were significant increases in sperm concentration and total sperm count in all age groups. However, when analysis was restricted to men with baseline testosterone 400 nanograms per deciliter or less, there was a mean 110, 133, and 136 nanograms per deciliter increase in men who were 40 years old or older, 30 to 39 years old, and men who were younger than 30 years, respectively. The next negative consequence associated with varicocele is infertility. While not all men with varicoceles experience fertility problems, the condition is more likely to impact those with unexplained infertility. In some cases, surgical intervention to correct the varicocele can improve sperm parameters and increase the chances of conception. In this meta-analysis looking at 10 relatively recent studies, including 1232 men, on how varicoceles impact sperm quality, it was found that varicoceles were associated with reduced sperm count, motility, mean difference minus 26.67%, and morphology, mean difference minus 19.68%, but not semen volume. This is likely to be impacted by many factors, including whether the varicocele is bilateral and how severe the varicocele is. Additionally, it is important to consider lifestyle factors, general health, obesity, and toxin exposure, which all generally impact male fertility. So what about treatment of a varicocele? What are the current treatment modalities and protocols, and what can you actually do about it?
As always, it is really important to consult with your medical professional if you think you may have a varicocele. According to this current review of evidence, the strongest recommendations for varicocele repair are represented by couple infertility or oligosteroteratozoospermia, which is a condition in which the semen sample has oligozoospermia, which is low sperm count, asthenozoospermia, which is poor motility, and teratozoospermia, which is abnormal morphology of sperm. Additionally, a grade 2 or 3 clinical varicocele, a patient age under 40 years, and a partner age less than 37 years. Additionally, if there is testicular hypertrophy in children and adolescents, then these patients may benefit from treatment. Indications are reinforced when OAT is severe and in younger patients. On the other hand, little indication exists to treat varicocele in azoospermic patients. Finally, an additional indication is represented by elevated sperm DNA fragmentation, particularly in partners of women who had undergone an unsuccessful ICSE or repeated miscarriages. If your doctor does decide that treatment of the varicocele is warranted, this study, which surveyed urologists and andrologists, suggests that microsurgical subinguinal varicocelectomy is the standard of care because it is associated with lower complication and recurrence rates and possibly higher improvement in semen parameters. However, it is technically demanding and needs access to an operating microscope. Not all surgeons are trained in the technique, but those who treat varicoceles regularly are strongly encouraged to acquire microsurgical skills to be able to perform subinguinal microsurgical varicocelectomy. It can be expected that there is a 50% to 70% chance of significant improvement in semen parameters after treatment, and a 30% to 50% chance of a natural pregnancy. However, this must be individualized based on clinical findings, semen parameters, hormonal levels, prognostic biomarkers, duration of infertility, and the couple's age. Most of the evidence suggests that if improvement occurs, it will happen in the first 3 months after surgery, which corresponds with the spermatogenesis cycle. However, men with severe sperm issues may take up to 6 months for maximal improvement. If improvement in semen parameters has not occurred by 12 months post-operatively, then it is not likely that there will be any improvement. Based on current evidence, surgery for subclinical varicoceles is not recommended, and surgery for grade 1 varicoceles may be considered after discussing the lower likelihood of significant benefit.
So what about alternative management of a varicocele?
This review, looking at both diet and supplements for varicocele treatment, notes that to improve sperm quality through diet, men should focus on adopting a Mediterranean diet which emphasizes plant-based foods, fish, and healthy fats, particularly from extra virgin olive oil. Increasing omega-3 intake by eating fatty fish like salmon and mackerel can boost sperm motility and concentration, and improving the balance of omega-3s and omega-6s is also important. A diet rich in fruits, vegetables, and whole grains provides antioxidants that help reduce oxidative stress, supporting sperm health. It's also important to incorporate monounsaturated fats, especially from olive oil, which can improve sperm membrane function and mitochondrial health. Some literature also indicates that cutting out certain things from the diet is important to mitigate the impacts of a varicocele. In a study of 52 patients with a high-grade varicocele, 2 semen samples were collected before and after treatment to evaluate changes in semen quality. The protocol required patients to reduce cigarette, coffee, and alcohol consumption, increase their intake of fruits and vegetables, and maintain normal sexual activity with a 3-day abstinence before semen collection. Results showed that 40 patients, 76%, had improved semen quality, meeting WHO criteria for normal semen analysis. Additionally, this study found that smoking was associated with a higher risk of varicocele prevalence, potentially because nicotine reduces blood flow.
And what about specific supplements that may be utilized to reduce a varicocele?
The same review, which provided diet recommendations, also highlighted many supplements which have been researched for being beneficial for men with varicoceles. These supplements are highlighted as lowering inflammation, boosting blood flow, and having antioxidant effects, which may help to mitigate the oxidative stress of varicoceles. Selenium acts as an anti-inflammatory by reducing oxidative stress and regulating inflammatory markers, potentially improving testicular function. Adequate levels of selenium can be achieved through eating around 3 to 5 Brazil nuts daily. Vitamins and antioxidants, vitamin C, D, E, coenzyme Q10, L-carnitine, zinc, and magnesium primarily act as antioxidants, which can also reduce inflammation linked to oxidative stress in varicoceles. Acian from horse chestnut improves venous contraction, blood return, and protects vein walls, while reducing inflammation and leukocyte migration, thereby decreasing edema and inflammation in varicocele. Morinda officinalis MOP, a traditional Chinese herb that restores seminiferous epithelium and reduces inflammation. Resveratrol, found in plants like grapes, this compound has anti-inflammatory properties and reduces NLRP3 inflammasome expression in varicocele, improving inflammatory response. N-palmitoyl PEA, a naturally occurring compound that reduces NLRP3 expression and regulates inflammation. This is a supplement that I do use a lot as it has a lot of useful properties. Berberine reduces immune cell infiltration and inflammatory cytokines, improving hormonal balance and testicular function in varicocele. This is also useful for blood sugar regulation, and Sean Wells, a mentor of mine, has a dihydroberberine supplement which actually outperforms regular berberine.
Now let's look at key lifestyle parameters that may impact your likelihood of developing a varicocele.
Testicular heat. One of the primary problems with varicoceles is that they increase testicular heat. Many other things can also increase testicular heat, and so through being aware of risk factors for higher testicular heat, men can potentially mitigate some of the negative effects. This study notes that wearing briefs or other restrictive underwear is a risk factor for higher testicular heat, which may exacerbate worse testicular function. Other risk factors for increased testicular heat are the duration of a sedentary posture, professional driving, sitting with portable computers and balancing the computer on one lap, sitting on heated floors, sitting on a heated car seat, tight-fitting underwear, and genital heat exposure in a water bath. It may be worthwhile counteracting testicular heat through reducing these practices. Importantly, some men with varicoceles may find it very uncomfortable wearing boxer shorts as they are less supportive than briefs, so this may not necessarily be possible for everyone. I also wanted to note that, as many of you would know, I've been a big fan of testicle icing for quite some time now. And while there is no literature on men with varicoceles and balls icing, potentially this is a helpful practice for these men to reduce testicular heat and boost functioning. Poor blood flow. Finally, poor blood flow from the testicles back to the body is also a potentially modifiable factor for men with varicoceles. Staying adequately hydrated as well as taking sitting breaks may be beneficial for blood flow. There is not much literature on this for men with varicoceles, but these practices are healthy for all people and so can be easily implemented into your life.
So that wraps up today's video on varicoceles. If you've learned something new or you think that somebody could benefit from this video, please like the video and drop a comment down below to support the algorithm. Otherwise, that's it from me today, guys. I'll see you in the next video.